Dr. Lee Angle here with Upper Cervical Health Centers. I want to talk about in this four-part video series about anxiety. It's a huge common problem. I see it in the office a ton. You look at statistics, it's the #1 mental issue that Americans and people deal with, about 18% of the population over the age of 18. So I want to look at what are the common causes, what are the common treatments, what succeeds, what fails, and how we factor in. So normally if you're dealing with anxiety, right, it can come in different forms. Some people, it's so severe they can't even leave the house, right? They've got such an anxiety of agoraphobia they can't leave the house. You've got people with a lot of social anxiety. I get in a group of people, I clam up, I get sweaty, I can't really function. Maybe it's panic attacks, or maybe just in general, every day you wake up, you kind of feel like this, like your engine is revved too high and you can't function. Whatever kind of anxiety you're dealing with, generally the core root cause of them are pretty much about the same, right? We've got multiple things. So we always look at, first of all, normally people look at, well, what's my external environment? What's making me feel this way? And so often people have looked at that and said, not really anything. I got a great marriage or whatever that may be. I got a good job, or I've got a stable income. The things that we all look at as base necessities. I have food when I need it. I can pay my rent or my mortgage. I don't have any reason to be so worked up, yet I can't seem to control myself, right? So if we fall into that category, what are the general treatments? We're going to take some kind of medication, which is going to try to alter what's happening inside of us, or we're going to go to maybe some therapy to try to talk and figure out what's driving us. But either way, we're looking at external and internal, right? So I'm going to look at some of the internal factors in this that you may not have thought of before, things that very often can generate anxiety and you had no idea. And if you don't know and we don't find and fix those, all the pills that people really don't like to take, often they have side effects, and therapy's great, but it's not always the answer. None of those things are going to get you where you want to go if we don't correct the internal things that can drive anxiety.